Hey there, everybody. Welcome to today's episode of Clear Picture Cares, where we're really here to bridge the gap between our clients' philanthropic visions and the inspirational leaders of our nonprofits that are dedicated to serving our communities. And I could not be more thrilled to have our conversation, our guest today that I'll go into. But first off, I'm Andy Merchant. I'm your host today. And we got Matthew Tannehill here, who's with OneRise Group. They're really committed to providing this much needed resource around those that are navigating, a mental health crisis. So, Matthew, thank you for taking time out of your busy schedule to join us in 20 minutes. Clear Picture Cares.
Yeah. Hey, so happy to be here with you all and just appreciate the opportunity.
Yeah. Well, I know you're busy with some great things. I think our viewers and our listeners today are really going to enjoy our content. I know, with what you guys are building out with One Vision and, just the much needed need. We hear it in the news every day. We know mental health and other services that you're providing, but we're really here to express it. So I know our 20 minutes of this conversation fly by. So as with all, let's just go ahead and jump right into it. And how we start with our audience and those that listen is that we oftentimes talk that, nonprofit leadership is really about passion over paycheck, right? And so we want to learn from you. Why did you get in this business? How did you get into the nonprofit space before you maybe talk about OneRise? So introduce you to the group.
Yeah, so absolutely. So again, thank you so much for having me. And I love that. I mean, it's about servant leadership when it comes down to my experience. I always tell individuals about my journey as a really young kid who was strapped to his dad's leg, afraid to depart from him, getting into kindergarten. And at that time, there was a great friend of mine who kind of put his arm around me and said, "Hey, don't worry, I got you," and blossomed into a great friendship. And he gave me strength and reassurance. But that friend of mine, he was diagnosed with the Duchenne muscular dystrophy. And for those that aren't aware of that, that's a severe muscular degenerative illness. And so really at a young age, I established a servant's heart and helped in providing care for him and developing just a wonderful friendship. And so, those experiences kind of really set me off on this journey of what it means to enter into this world of service, especially in the nonprofit world. Through education standpoint, I ended up majoring in Spanish at Friends University here, and that actually led me to really entering a lot of different opportunities in the nonprofit world utilizing that language, but entered in from experience in working with a federally qualified health clinic doing patient project access and helping do patient relations, getting them set up with care, to operating a food pantry, helping those that are facing food insecurity, and ultimately also helping with doing workforce programs for individuals experiencing homelessness. So, my journey really just entered into getting this heart to provide service to another individual that may be in most need.
We don't have enough of you in this world. I mean, so, and that's what I love about this format and this platform. We just need to let people know, about those that care. There's a lot that can care with their money, but to care with their time is a completely different avenue of it all. So tell us a little bit then about, so how did you come to be part of OneRise, take on this mission? I know we're going to tell the audience about your huge undertaking you guys are doing, but how'd you get involved? And tell us that story.
Yeah. It's an interesting world. So as I mentioned, kind of my career has navigated in a variety of different nonprofit sectors. And within that opportunity, it kind of helped me understand and see what type of collaboration was and really wasn't happening within the ecosystem that is social services. And, most recently, the work that I was doing was, again, workforce development programming for families experiencing homelessness. And what we were experiencing there is, families were entering sheltering, and our case managers and staff were doing the best that they could to help get individuals into housing here, but simultaneously we had to help them navigate getting work to be self-sufficient, helping them try to navigate the barriers of transportation, the barriers of childcare, and how they navigate the ecosystem that, will help with the other wraparound services that they need to be successful and be, again, self-sustaining.
Mm-hmm.
And through that work, I kind of, got to see that, yes, collaboration was happening where clients were getting introduced to other services. But at the end of the day, there was still a gap and really a challenge that was put on the clients to try to, navigate that on themselves here. And really what we saw is either the efforts of doing that, people were in such states of crisis that it exacerbated their condition, or they were so focused on the crisis at hand, they just couldn't commit to the next thing. And so I remember just driving down, Wichita, wishing there was a way for us to really think about the system and how a variety of services come together, and touring, Town West here and saying, my gosh, wouldn't it be amazing if we could have a campus here for social services to make it easy
Yeah.
for individuals to access? And, in my mind, that was a pipe dream. And then back in, 2022 here, a couple of years ago, I got introduced to Jeff and Patty Lang. And I got introduced to them and understanding their passion that's in the world of behavioral health, mental illness, and persons
Mm-hmm.
experiencing homelessness, and this radical vision they had of creating what I was thinking here of a campus that is devoted on health, mental health,
Yes.
substance use health, just helping with the social determinants of what may be may be hindering a person from getting to a successful life here. And
Yeah.
so hearing Jeff Lang and Patty Lang and their families' passion, and understanding that we all face these issues to some degree, and seeing that their heart was in to make our community transformative, and knowing that, currently in the mental health world, our state is ranked worst out of
Mm.
all the different states in our country here. And we just have to have positive outcomes to make
Yeah.
positive change. And this was an opportunity to do something radical and to do something extremely innovative
Yeah.
for our community.
Well, and I love your wording there, radical. For those that are tuning in, and when you get a second, and I know we'll cover this, but if you go to the website, and I know I have it here, it's onerisehealth.org. There's the master plan on there. I mean, this campus and the vision and the sources and the resources you guys are putting in this, from even outdoor gardens and some
Yep.
some other things that you're building. I know we'll dive into here in a bit, but check
Yeah.
out the website. I feel like, for those that are listening, the easiest way to get aware of something is go check out the web world today,
Right.
until artificial intelligence starts telling us what to go to, right? But I think that's a really good segue. I mean,
Yeah.
let's expand a little bit more. I mean, obviously, a radical movement and need. Share a little bit about why your guys' strategic vision is so needed in the community. Why you have alluded a little bit, but just dive into why the community needs to be so aware of this.
Yeah. So, there's been initiatives that have been happening around the United States that are trying to, do innovative work to where they're bringing a lot of different ideas collectively to make improved outcomes. But there's just not a lot of groundwork being done or a lot of positive outcomes coming. And so it really comes back to the journey that Jeff and Patty Lang made back in 2019, where they were touring Haven for Hope. They were understanding that there's this new precedent in the United States of a campus environment that wasn't just about co-locating services, but it was also looking at the systems in which somebody access services, and then how they navigate the continuum of care to make sure that, one, they can get their immediate crisis or immediate needs met, but then continuously working through their treatment or whatever their case plan might be to reach to a more self-sufficient life that helps in reducing any type of recidivism back into crisis.
Mm-hmm.
And so when we talked about our endeavor here, we knew that there wasn't really anything like this in the United States here. There was campuses like Haven for Hope, but there wasn't anything to this scale of 70 acres. So when we first understood our community gaps, we knew that one, Kansas was desperately in need of mental health innovation to help, increase access, to increase, equitable opportunities for mental health care, as well as creating innovation that will bring on healthcare professionals, but then also give them something, really, really, I would say, give them something that they'd be proud of working and being part of, so we can retain that workforce here. And so when Jeff and Patty Lang toured Haven for Hope, one of our first pieces here was to understand what can we do to bring the experts to our community. And so that's where we partnered with the West East Design Group. That was the main design and architect for Haven for Hope, and bring on their social impact studio that focuses how we can create something world-class, but focuses on the person's needs and the person's care through person-centered planning. And so what that landed us to is establishing what will set us apart from what has always been. And this is where we talk about our guiding principle of creating a world-class precedent of landscape that creates a trauma-informed and recovery-oriented environment. So when listeners and viewers look at our master plan, they'll see that our project is rooted in the heart of a 10-acre campus, to show how we are wanting to be intentional with the partners that we have to have nature be at the heart of what they're doing, and creating an environment that's going to reduce stresses, give individuals more of a recovery and healing atmosphere, so that they can truly get out of that crisis mindset and be able to work on their treatment and what they need to reach that, again, sustainable life.
Yeah, and I love that focus, right? Because, your environment is such an important element when it comes to trying to, improve or change habits or recover from something that you have less control over, that's out there. So just the focus that the teams put on this, and it's just I do see it. We hear, and the thing about Wichita that we all know is there's a lot of people that want to help and do good, and everybody wants to solve a niche. The problem is that niche needs to be solved with more than one or two or three people, and there's no collaboration to where they have a single unit. So I'm really excited. I think that's really the exciting part of what you guys are building, is creating that collaborative environment so that we can focus our resources versus fragment our resources, right, to help the same cause. So
exactly.
Yeah, so that's exciting there. So maybe give the viewers, I know, because the land's been purchased, there's no development yet. So maybe give some timelines on kind of where you are and what to look forward to over the coming months and years.
Yeah, so I'll be looking forward to following up with you later on.
Yeah.
So the biggest news that we have is we were the site selected for the regional mental health hospital. So county and state, based on their timeline, would want to see construction start by fall of this year, I believe November. And then they would want to see that hospital be vertical by the end of 2026 and operating the first part of 2027. So great news is that we are a shovel-ready site, meaning we've already got platted and zoned the right way for the variety of different programs and innovative services that can exist on the campus. And the next piece that we're doing here as we land this regional mental health hospital is then dive into the remaining phasing of the campus to understand, okay, what is the next pieces that are going to help, support the regional mental health hospital and making that an amazing project for our region and community. But then also, what are the things that are going to help support that? So again, within our community, we know workforce development is a critical thing. So when we think about, a 50 to 100 bed facility, they're talking about over 200 jobs here. And so if you look at our master plan, that's kind of where, when we look at the phasing of the plan and how we continue the development is, childcare is going to be a big thing, not just for clients or the surrounding community, but then also for the workforce that's going to come in there. So there's going to be opportunities, I would say, that we're going to be really intentional on driving that would be childcare. And then again, the federally qualified health clinic. Southwest community in Wichita has been historically underserved. It's a medical desert, a food desert area that's desperately needing resources. So when we talk about innovation from the OneRise campus, it's not just the development on how we can serve those that reside on campus, but then how do we grow this opportunity to serve the surrounding area as well? Yeah. And those two projects would be critical next anchors for that. Okay. And the last piece I will be excited, again, I mentioned our guiding principle is about nature, and one of those exciting things is agronomics and urban gardening. So we're partnering with ICT Farms to come on board and do some farming opportunities for therapy and for economic workforce opportunities for individuals that are experiencing maybe mental illness or other conditions. The piece that excites me about that, Andy, is the other piece about this is destigmatizing mental health, right? Yeah. And what we want individuals and want our community to understand is, like, this is a mental health hospital that impacts the lives of all of those in our community. What we can do with nature, agriculture, and these types of offerings is to simultaneously look at how we treat mental illness, but then also growing something beautiful and understanding that there's beauty in mental health, and that we together can, reduce that stigma and understand how we can really make transformation together. So those are some of the exciting things that we're looking forward to. We'll hopefully be touching base into 2026, Andy, and I'll be standing outside of a mental health hospital. Yeah.
Well, there's going to be a lot to check out. So hopefully those that are viewing and listening in the Wichita area, head to the south side of Wichita, and keep tabs on the progress, right? But, and another factor of that, I think it's a good next transition is, the purpose of these Clear Picture Cares webinars, conversations that we do is really to create awareness around our viewers, or for our viewers overall. Share with us today. I mean, this is your time to ask. There's a lot of things you're going to need, right? Share with them right now. What is the top priority list of things that you need to help make this mission continue to grow and become a reality?
Yeah. So I always focus in terms of my time in working in the nonprofit world. It always comes down to like time, talent, treasure in terms of how individuals want to be involved. We are always looking for individuals to help champion what we're doing through OneRise, through advocacy, and through just contacting us in the desire to be involved. Educate yourself. The next piece is understanding the systems that exist within our community. I think if we as a nonprofit or in any of us within the community that are asking for an individual to engage, our hope would be for them to educate themselves on what's existing and what's happening within our community within these areas. And then, lastly, as we're developing this project, we're going to need a lot of philanthropic support to raise these funds, to raise these building opportunities and help lead these things to be successful. So as people go and navigate the OneRiseHealth.org website, they'll see a donate button that they're able to make a contribution should they feel inclined. But really, my goal for our community and what we want to do as OneRise is a facilitator, we're a venue, we're a collaborator, an educator on these areas. And I really encourage individuals to reach out to us and ask the questions, get informed, and join us, help be a champion for OneRise.
Yeah, so you just teed it up right there. So those that are listening are ready to reach out. They're itching at making a contact to you. How do they do that?
Yeah, so if they go to the OneRiseHealth.org, they'll see that there's info at OneRiseHealth.org email. If they email any questions that way, it'll go directly to me, and I'll be able to get in contact with them. Additionally, on there is our phone number on the site. Again, that'll be directly to me as well, so I'll be able to answer any questions as well, that would be the best way. And that phone number is 316-239-5621. So reach out. Andy, the thing I always leave with, there's always it's kind of a quote that I've heard, and it kind of resonates with OneRise here is, a society grows great when old men plant trees in whose shade they know they shall never sit. So, that quote just, encapsulates philanthropy beautifully. When you think about philanthropy, it's about investing in a better future. Even if it may not directly benefit us right now, or we may not benefit from those actions, it just gives us some clarity that the impact that we have now is going to be able to give, make a better world for the next generation. And when we talk about OneRise and the magnitude of what this project has an opportunity to do, it is a generational project. It's a legacy project. So, if that resonates with individuals who understand what that saying means and how that shade will be available for the next generations to come, I absolutely encourage you to reach out.
No, I love how you said that. I couldn't have ended my next question any better than you just stating that. So, there's no need to tarnish anyone of that, because that's true. I mean, I'm sure there's many of you listening out there joining today that are reaping the benefits or enjoying the benefits of the shade that someone else, planted. And so it's our turn, right? And, the community of Wichita usually is really well banded. We get together, we get behind it, we value our community. So, I appreciate that, Matthew. I appreciate the time. As we wrap up today, I just really want to express those listening. Community involvement is so important to all of us. We don't have a community if we're not involved. And, if we can't take care of just everybody that needs help, then, what are we really standing for? So I hope that you took some of the messages, know how to get involved. You see there's some really strong names that are behind this. They're putting their commitment. They're hiring great leaders, getting involved with Matthew and what he's doing. But the ask is to you now, right? Reach out, OneRiseHealth.org. You've got the phone number earlier in this, but you already know. You want to talk to the man, Matthew, over there. All you have to do is hit the contact button. Everything seems to be flowing to him. So, hey, Matthew, again, thank you for joining us today. Really appreciate your time. And we look forward to getting everybody connected with you.
Yeah. Andy, thank you so much. I appreciate the time.
You bet. Hey, thank you, everyone who tuned in today to this edition of Clear Picture Cares. Now let's go out and make a difference today. Have a great one.